Oh, they've always been sensitive in the front leg. So you're pre-covering yourself so they don't say, all it did is shift the pain to somewhere else in the body. Very important.
Squeaky wheel gets the oil.
Yes.
Yeah.
And talk to them about that. That's kind of what we want to do. We want to talk to our people before we treat them. Explain these things. We always say it's chasing the pain. Like we're going to chase it a few times until we catch it. So we're going to start here because that's where your pain is, but it may then all of a sudden your knee, we're going to chase it right out your body. And so we'll work through them, and if they realize that they're going to have to chase things, and then they are prepared for that, and then they'll come back. And you might want to buy a month's worth of sessions because we're going to chase this all the way through your body.
Yeah.
Yes.
Right. And as far as, one of the most common questions is how many treatments is it going to take, and this and that. There is no way to know. Some of the people that, I shared yesterday, the guy with the frozen shoulder, one treatment and it was released. One treatment. How long does an aspirin last in the body? 4 hours, 5 hours? A person has a headache, takes an aspirin, it's gone for 3 months. So it's not that the aspirin is lasting 3 months. So there's no way to tell. One of the number one lines I use is, if every snowflake on this planet is different, you can imagine how different every physical body is. Trillions of cells, where a snowflake is like one little cell, and every one is different. It's one of the miracles of nature. So, just as an aside, one of my really great clients, she has just like a chocolate lab named Boom Boom.
Boom Boom.
This dog is like Norm from Cheers. Remember Norm from Cheers? Hey, Norm! This dog is just like Norm from Cheers. It's just such a loon. So she is a therapist, and she does therapy through yoga, meditation, massage. She's just dynamite lady, maybe in her mid-30s. And one day, we always have these great talks because she's on that energy wavelength. So, I told her about this, and she said, well, can I try it, and this and that. She treated her lower back, and she said, oh my God, this is better than any yoga or anything I've ever done. Next time she came in, did it again. And I said, why don't you get one? And she goes, oh, $21,000, oh God, this and that. And then each time she came in, she was like, I don't care, I'm gonna go to get a lease, I'm going to the bank, and blah, blah, blah. She finally gets one. Next time she comes in, she goes, I had a professional studio drummer with neuropathy, both hands, hasn't felt his fingers in like 15 years. During the first treatment, he screamed. He had sensation in his fingers. She said now, the word is out. She has lines of people out the door, and she's going to hire 2 assistants because she can't handle the load. And she just says, you changed my life for the better. This is all I do right now. It's just blowing everything away. So, I have an advantage because I'm a veterinarian, so I'm licensed to treat. But the disadvantage for me with the people is that I can't go near people treating them, where you guys, being the lay public, probably have a better chance of treating people. Maybe there's a gray zone. Who knows?
Well, we do the same thing that you were saying about letting them use it. We have some people that we've termed their entire website, they rent the machine. So they provide their services free of charge, and whenever they go to someone's house, they're renting their equipment to them. And that person signs a rental agreement for that 30 minutes. And we had our attorneys draw all that up. We have that available for free if you guys want it. So all you need to do is print those out and say, hey, I'm renting my machine to you for 30, 45 minutes. I'm gonna sit here and show you how to use it on yourself, and I'm gonna provide my services to you free of charge. You're paying to rent the machine. And that is the best way to get around it. Their websites reflect that. As they rent their machine to people, and it's a great way for people to get out. Like. And you're not diagnosing, you're not doing anything, you're letting the machine, you're telling, well, this is what the machine is saying. The sensitivity is here, and that's what the machine is showing you, and that's it.
Which is good. Now, in animals and in pets, pain radiates. I can't tell you, or even estimate, how many dogs I've seen come in because they have a problem with their paw. And the people are certain that there's a splinter there, or a thorn, or something like that. You know how many times I've actually seen something in the paw in 44 years? Maybe 6 times. And you touch the paw and it hurts. It's radiating from somewhere else. What's good about this thing is that the wave radiates. So if you put it over the hips like that, it'll get the whole leg because it radiates right down. So sometimes if I know I have a knee problem or a stifle problem, I will treat there. But sometimes you treat there and it'll go right down the whole leg and it'll also get down there. I've seen people treat their shoulders and their cramped hands. All of a sudden, oh my God, my hand feels great. Because it radiates, it seeks out pathology and it goes right to it.
What would you guesstimate the distance that it would radiate? Would that depend on the intensity?
Intensity,
on?
absolutely,
Okay.
absolutely. And that's where the big Magna Wave,
It's awesome.
it's just right. It'll go through walls. It's just
But if they can only take it low, like if it's only comfortable to a dog, like my dog will shake. She likes it low. Treat them that way anyways. It doesn't have to be strong to radiate all the way down. For her, that's a comfortable setting.
It just
works.
moves around.
Move it around, yes. Or
Right.
treat a little bit longer. Instead of, if she's particularly sensitive one day, I may do 15 minutes or 10 minutes on low instead of 3 to 6 on high. Because I'm getting that same amount, I'm just gonna need to treat a little bit longer.
Yeah, and then some warnings. Anytime a person is in the room, ask them if they have a pacemaker.
Yeah,
You don't want to be up for murder.
yes. Oh.
And
Okay, on the pacemaker thing, my dad had a pacemaker for the last 7 or 8 years, I'm not sure. He had a new one installed about a month ago, and I was talking to his doctors about the Magna Wave, and they said, I tell you what, I don't know what you're talking about, bring the machine, when they hook him up to the computer, we will put your machine on him and see if it changes any of the signals. And we didn't. My dad was like, are you sure we won't?
oh my God.
I know, can you believe this?
I was like, Dad, we're in the hospital, it'll be okay if something happens. And he allowed me to do it, and it did not change any of the signals or the battery strength or anything.
Oh.
Right.
I am not saying.
At high levels?
Yes.
There's different
Yes.
brands of pacemakers.
Yeah,
I've
I wouldn't
actually
trust
talked
it.
to several doctors about this. So they use the battery to shut a pacemaker off when somebody dies. And so that's, without having to cut them open, they can put a battery. So some of them can, just a stagnant battery will shut off the pacemaker. Some of them, they don't do that. They actually have a different device or a different type of magnet or a different thing that will turn it off. So that might be one of the kinds that your dad has. So better safe than
Oh,
sorry.
definitely.
Absolutely, for
Oh,
you,
yeah.
it works, and I think that's awesome that the doctor was
I put
able.
the disclaimer on there. that
Everything.
not-
And you
Yeah.
need to ask everybody because my brother, he's in his late 30s, I should know his age, but he has a pacemaker and he's in his 30s. So you gotta ask people,
It's
because
a
you
must.
think
You
that,
gotta-
only 85-year-old men will have a pacemaker, and that's not
And there's other devices too that are electronic.
Yeah, stomach pumps.
Yeah.
One of my friends, she has a stomach pump that keeps her stomach moving so she can digest food. Anything that's battery operated and implanted in your body.
But
And
one thing
they-
they did say was keep anything I want to do from the waist down. That is one thing they did say.
Yeah, I
When
mean,
we
it's
turned it
just,
up,
you know,
they
they're
did-
saying keep it away from computers. When
I
I'm
don't.
on my computer, I'm treating
Me too,
myself
all day.
all the time.
But don't do that.
I have reset my watch
I'm not buying you a new
to
computer.
all zeros 3 times. Where all of a sudden, you know, I went like this over the watch while it was on to go to another spot and all zeros.
Okay, so it's just the attachments, not the machine?
It's
No,
the attachment.
Just the attachments. I used to have an Apple Watch before I dunked it in a pool of water. And that will ruin your Apple Watch. But if you, well, not the new ones, but if you have, I treat horses and my dog all the time with my watch on and had no problems whatsoever. But the pool got it, so, be careful.
One other warning, and this happened to me, and I still have nightmares about it.
Gosh.
Especially if you have the big machine, and you're changing coils or mats and this and that, and you turn it on, and you go like this, and you go, I'm not hearing any noise, you forgot to plug it in. When you plug it in, it'll discharge through here.
Yes.
And my wife's back was seriously out once, and I went to put the large coil on her, forgot to plug it in, turned the thing on, she had the coil on. When I plugged it in, a jolt hit her and threw her out of the chair.
That will only happen with the Max and the Pulse Pro
Yeah.
because they are analog machines and the signal builds up to go down the coil. And
Very
it will not
important.
stop. If you don't have that, it's sitting there waiting to get out of the machine. So,
As soon as you hit the green button is when it did it?
No, you hit the green button.
And there's no
And
attachment.
there's no attachment. When you go to put the attachment in,
It's
it'll
waiting.
discharge through it.
Oh.
So if that does happen, the only way to discharge it is by putting the attachment in there and prepare yourself for, it's gonna go.
it's gotta come out. So
Yeah.
that's what we always say,
Very
to, turn it
important.
off. Very important. Now, if you have a digital machine, that is not a problem at all. You can technically, you can change screen and treatment. We don't recommend it we recommend you turn the machine off, but it will
Every time.
never discharge anything. It's got a computer
Yeah,
chip
very,
that
very important.
drains it automatically.
Any other warnings? Well, obviously, credit cards,
Yeah, no, if it's on,
watches,
only when it's on.
cell phones. Yeah, anything that you think is
Car
electronic,
keys.
better safe than sorry.
So they can't be in the room or the.
No,
They can't.
near the
Just
coil.
don't put it on the coil. I had a guy who worked for us, and he had a brand new iPhone in his pocket, and he had a cramp in his hand, and he put the zoom paddle on his pocket, and then put his hand on the zoom paddle and turned the Max all the way up. And he was like, my phone doesn't work.
Yeah.
And I'm like,
It'll fry it.
yeah, we have a sign in our office that says remove all electronics, and we keep a little bag. I take it with me when I go treat, like a little, it's not a bag, it's a basket.
Yeah.
And I walk in, I say, put everything in this basket, and then I put the basket right over here away from me so they can see their belongings, but they stay over here. So just take a basket with you.
Real important. Now, one thing that I do a lot is when I'm treating a patient, because I've injured my hands a lot. I used to play four-wall black ball handball when I was at school. And then you're wearing a thin glove and you're hitting a ball as hard as a rock. And I did it for 7 years. And it really scarred in here. The Magna Wave, it actually loosens the scar. The scar's been there for 40 years. And it's amazing. If you take the paddle and put it on, and you do it for like 20, 25 minutes, it's like, what? It'll get rid of deep internal scars. So when I'm treating a patient, I'll put my hand in and get treated too. It's not to waste any time.
What do you do with the dogs that are less cooperative than this little girl?
Technicians.
Ella is not
Very-
very cooperative. She will
Yeah.
run. I mean, she does not. She was
Yeah.
abused as a puppy. I adopted her. She was trapped in a kitchen for days and days. She doesn't like to be on a chain. She is very jumpy right now. So I hold her and I always talk to the person first because I don't have a technician. So I always talk to people. I'm like, hey, let's talk. Let me meet your dog. Take your time, just like you would when you're going to pet it. And if they are uncomfortable, don't treat them.
And we almost always have the person, the caregiver,
Always.
mommy, daddy, in there, because they like to see it. One thing I've seen, invariably, is, especially with the bigger dogs, while they're getting the treatment, they're relaxed, but they pant a lot. I forewarn people, they just pant. It's just, I don't know what it is, but they just pant a lot.
Yeah.
And,
Okay, so with the large loop, if you do the hot dog, or if you twist it and, do one
to
of
make
those,
this, yeah.
is that changing the polarity, or is
I don't think so. I've seen it act just like this.
You do what?
I've seen it act
Okay.
just like this. But if you have this, Pat taught me that little
Right.
trick. But if you have this, you just use this instead of crimping that one.
But if it's like this, my dog's gonna run. But if it's like this, the signal is going like this.
Okay.
So if it's like this, the signal's going into the middle, it's like a fountain. But if you go like this,
Give me.
and you use it, so if you have it like this and you have something, the signal is going like that.
Oh, okay.
So if you're wrapping, like if you have a horse, it's very similar to this. The signal is going like this. So that's exact, but you can manipulate this to bring that signal through.
One very
You can
important
twist
thing.
this, but we don't recommend it. My father does it all the time.
Yeah.
But you're gonna damage the coil over time.
Exactly.
I mean,
So
you
use
are
this.
gonna, so use that, you know? But if you're in a clutch, yes, you can do that.
The head is extremely sensitive.
Yes.
So the proper way to treat the head, if you're a human, is you hold it over here, have it on low, and bring it till you feel it. With animals, it's tougher. We had one of my clients that got one of the big units. It was because a 5-year-old French bulldog had a serious brain tumor. And when the dad was an incredible athlete that had a very bad injury, and it ruined his life. So when he was down, we did a 3-day intravenous. They came down from the Boston area, and he used it. So they got one, and they were treating their little French bulldog 40 minutes 3 times a day. And this dog literally had a week to live when it came, and we got maybe a year. So, and you know, a year for a dog is like getting 5 to 7 years on a person with a brain tumor. And now, you know, he's back being an athlete because they have the machine for themselves. But what you do is do it on yourself first, so you know it will target dental problems.
Yes.
Oh my God, it'll go right to a cavity you had when you were 4 years old. It goes right to it. So you can imagine if a dog has that, but they are not telling you. So what I do with them is you just bring it close, and you'll see them either flinch away, because you know, the big Magna Wave is the most powerful thing out there. But they will, like Pat says, they will all work. The one that got FDA approval, I told you, is just a battery and a coil. You don't feel nothing. They don't feel nothing. And it still works, and they're now documenting many cases after cases and putting it in society. So when in doubt with something like that, better to keep it lower than higher. It doesn't have to be that strong where the head is flinching like that. It'll work.
Yeah.
And you know, brain tumor, we've seen tumors shrink. So
Yeah, tell
I have
that
no
story. Like, what do you do if a dog has a tumor? What do you do? Like, how do you go about treating it? How long?
Well, usually we're using this for several reasons with the tumor. Number one, it's anti-inflammatory. Tumors, especially bone tumors, they hurt. I mean, they really hurt. So we'll use this to get the anti-inflammatory effect. You know, some of the new theories on cancer is they're post-inflammatory, that you have a severe chronic inflammation that weakens the area leading to the growth of the tumor when normal cells going haywire. So anytime you reduce inflammation, hey. But like I told you, it's scientifically documented that this will increase the absorption of a medicinal into an area treated up to 200%, or 17 to 37%. So we're also using it, you know, we don't just ever use this. We've been doing alternatives for 44 years. So I relate to you that a couple of my patients, I just used this and it worked. It's just so I would know if this works. But because we're not, you know, research scientists, we're clinicians, that I would not deprive any of my patients of the other modalities that we know will help them. So they'll be on supplements. We'll give them acupuncture. We do a lot of acupuncture and Magna Wave at the same time. Sometimes we'll alternate. Every patient is different. So, you know, one of the things that really pisses veterinarians off when they see some of their patients come to us 3,000 miles and their terminal patient is now running around normal, they call, can you give us your protocol? No, we don't have one. It's patient by patient. Can you give us your intravenous vitamin C protocol? No, we don't have one.
It's communication with the person that,
Right.
and the animal you're treating.
Right.
It's the key
How do you
to
treat a
everything.
dog with Magna Wave? It's based on that dog.
And that's a lot of times people are like, give me your protocol. How many times, I mean, you guys have gotten on the Facebook page, what's the protocol for this? There is no protocol. There isn't. That's our
Basically.
greatest secret. We don't know. What we do know is if you put the coil on there and you turn the machine on, that's probably gonna help. So it doesn't matter what coil you use, just put it on there 6 to 8 minutes. I've had people call me and ask me that question 100 times, and I literally say the same thing. We'll get a coil and plug it in and put it on the area for 6 to 8 minutes and see what happens. You know, they're gonna feel good, you're gonna see some walking. You have to learn. Getting that confidence in what you're doing is half the battle.
Any Magna Wave is better than no Magna Wave.
Absolutely. I should get that tattooed on me.
Yeah, any Magna Wave is, and like vitamin C, we usually do a 3-day course where the first day is an acclimating dose, and we see how the patient does. We almost always want to send them home with the people that fly in from different parts of the country. They get a pet-friendly hotel because we have to evaluate how the second day's therapy is based on how the patient did the first day. If they're doing great, we'll almost double the dose the next day. But a lot of people say, if I can't do 3 days, you know, if I do 2 or 1, the thumb rule is 1 day of vitamin C is better than none. 2 days is better than 1, 3 days is our best. So any Magna Wave therapy. You know, I told you that I treated I let my dentist technician put the coil on her inflammatory bowel disease or irritable bowel syndrome or chronic pains. In 1.5 minutes, she went, oh my God, it's gone. And it was gone for 3 months. 1.5 minutes. It's just like, what?
Yeah, I've had the same thing with plantar fasciitis. I had a guy who had horrible plantar fasciitis, and we treated his foot for 15 minutes on Easter Sunday. It was actually my brother-in-law. Easter Sunday, I put it on him, and he thought he thought I was nuts. And I was like, just try. And he tried it. He called me the next day, and he was crying. And he was like, it's gone. I've never treated him again. I don't have to.
It's just like that. And for the extremities, I have found that the paddle works so much better than anything else because it pinpoints. It's very hard to get to the extremities. So I was trying to treat my hand with the coil, and I was going like this, like this, like this, like this, and this. The paddle, put your hand on it, and it goes right through your entire hand. It's just, love that paddle. So.
Does anybody else have any questions? Yeah.
I have a dog I'm actually working on right now that cancer in the left leg, they removed a toe, first of all, thinking that it was just in that. And then like 3 months later, they went back and did an x-ray and it's throughout the whole leg. So now, since Magna Waving, feels better, appetite's better, but again, she's questioning how long, how often we should do it. And
Are you
of course,
doing anything else?
She's got on, some different.
She should be on that because if surgery doesn't cure cancer,
Right.
radiation doesn't cure cancer, chemotherapy doesn't cure cancer, it zaps a symptom. It removes a symptom. That's it. Cancer is an immune deficiency disease that lets normal tissues grow haywire. Simple. The cure for cancer is called, we've been looking for the cure for cancer for 70 years at the tune of probably $15 trillion, and it's always been here. It's called health. God, if it wasn't for his tumor, he was in great shape. Bull. If it wasn't for his heart attack, he really looked good. No. So if you want to cure cancer, and that's a very bad word to use, because cure all of a sudden is like, oh, I don't have to do anything. I'm cured. No, you put cancer in remission. If you want to put cancer in remission, you got to get the immune system working fine. Some of my most successful cases of all time that I present to the universities, and it blows their mind. We had to do surgery 3 times within 17 months as the cancer grew back while we worked on the immune system. And then all of a sudden, it doesn't grow back anymore, and they're alive 10 years later. And we have it all documented. It's blowing their minds. So the treatment goes at the symptom. Since this gets to the basement membrane of life, this could possibly be, quote unquote, curative for cancer. But still, I wouldn't rely on just this. There are so many nutraceuticals that are out on the market right now that are now getting accepted by conventional veterinary medicine. The mushroom fractions are incredible. Maitake mushrooms, reishi mushrooms, turkey tail.
Mushrooms, though. I've never heard of that.
Oh, the mushroom, right? Yeah. There's a mushroom expert right over here.
Really? Why'd you chat about that?
Yeah, mushroom head, we call it. So, you know, oh, really? Rotate in 8 minutes?
Yeah, we're rotating in 8 minutes.
Treat your dog.
She has plenty of time to get treated. But you know what I noticed with Ella is that she will have a little bit of movement. I'm gonna turn it up here. We got a Maya.
Oh, yeah, the other thing that we didn't get to, very important, is now you're gonna use this diagnostically on the dog. And you'll go to different spots, and she's so damn healthy and stable.
I take really good care of her. She's my life.
Yeah, or you can go like this.
Besides my children, obviously. But she's like real close with them. Yes, you're such a good girl.
And you'll actually see, God, she's stable.
I'm gonna tell you, she tore. We went about 3 years ago. We went to the vet. She was limping very badly, and they told me she had a torn ACL, and that I needed to get a pig part and put it in her. It was gonna cost me $3,000, and I almost threw up right there at the vet. And I was like, "Ooh." Well, of course I was gonna do it because it's my dog. And my husband was like, well, let's take her home and let's Magna Wave her. So I started treating her, and my dad. They convinced me. I treated her about every Monday through Friday for a month. And I went back to the vet. She wasn't limping at all, and they told me it was gone and that it must have been a misdiagnosis. And I said, what? Like, you showed me it. Like, I saw it. You know? You told me it was there, and it was gone. And she doesn't limp at all anymore.
Do you know what the cruciate industry is called in veterinary medicine?
No.
Cruciate surgery in veterinary medicine is called the billion-dollar industry. Yeah. And that's what its nickname is. We get, before the Magna Wave, about 50% of all confirmed cruciate ligament ruptures to function normally in life without surgery. So if you took a cruciate rupture in a dog and you just opened up their joint and then closed it up again, you'd probably reverse it because it'll just scar in and stabilize it. It won't grow a new ligament. So now with the Magna Wave, it's just enhanced tremendously because it's been proven that it enhances the lay down of new stem cells. You saw it in Bob yesterday in his presentation, how the bone fills in. And they've showed in the NASA studies that osteoclasts, which are immature bone cells, you have an enhanced production of osteoclasts. This is a horrible patient. There's not, I mean, usually you'll go there and it will fasciculate. You'll see it jumping like this.
She used to jump all over. When I first started treating her, it was like she was like this all the time. And then now
That's amazing.
I treat her all the time. I switched her food to the food in the refrigerator section of the store, and it changed her life. I mean, she was a totally different dog. I mean, she was dying. She was limping. She wasn't eating. She was miserable. And I changed from Beneful to the pet. It's terrible. It's horrible. I know. I didn't know. It looked good. They have good commercials. I poured it in the morning. And then I went and I got
Best packaging in the world.
They do. And then I went and I got the stuff, and my doctor didn't tell me to do this. I just started figuring it out, my vet. And I went and I got the stuff in the refrigerator section, which you can literally eat. It's so good for you. Like if there was a traumatic thing, I could eat it and be fine. And I started feeding it to her and Magna Waving her every day, and it was like the two went together, and my dog was back, and she's healthier and happier than she's
Yeah, and
ever
that's
been.
what, like the cancer patient, it's diet, fish oil, and then Magna Wave, and the Magna Wave will enhance the absorption of the good stuff you're putting in.
She has cancer on her chest. She has a cancerous tumor. But
That tumor?
yeah, there's one right here too, on her other leg. Or is it on the other side? It's on the other leg. There's another tumor.
Let me see. Get up, you.
They tell me it's cancer. It's very aggressive, and do you feel it?
Tumor,
It's right here.
what is tumor?
It doesn't grow. I
mean
treat
in
it all the
Latin?
time. Just stays the same.
What does the word tumor in Latin mean?
Growth.
Lump. That, to me, is not cancer.
I'm telling you, I'm a terrible vet.
Yeah, that feels like a chronic cyst. I mean, I wouldn't
They
know.
want to remove it. They're trying to bill us to remove it. They removed one off of her chest, and it was really hard on Ella. I mean, the surgery was hard. I had to carry her outside to go to the bathroom, and she's 13 years old, and she seems so sound to us that we're not doing
We'll
it.
use a tumor as a guidepost of what we do. So when we see a dog that has a confirmed malignant tumor, we will leave it there, go on a supplement program, and if the tumor shrinks, that's great. If you remove it, you don't know what's going on inside.
Yeah.
So usually if the body is going to shrink a tumor externally, it's also going to handle it. Remember, I hate the word, but it's the holistic approach. You're working on the whole individual, not the tumor.
Is that not the name of your book? The Holistic Approach?
No, Nature of Animal
The
Healing.
Nature of Animal Healing. Get his book,
Right.
it's great. The Nature of Animal Healing. I read it, it's very in-depth, but it's a great book.
And it's a double meaning for nature. The nature of animal healing, the definition of nature is, how it does it. The nature of a storm is to blow stuff away. But also, nature is the healer, not the doctor. Physician, heal thyself.
You got a question?
So what is your protocol?
Flunk.
Have you been listening?
With a dog like a Weimaraner that's like 11 and all of a sudden the fatty tumors are just exploding
Yeah.
everywhere.
Well, to me, fatty tumors is not an immunological condition, it's a metabolic condition. You're getting accumulations of fat. So every patient in our hospital gets blood taken, and we do a metabolic analysis, and we put them on supplements based on their own blood. You tune up your car before it fails, period. And then we have fat digesting enzymes. One's called megalipotropic, and there is a Chinese herb from the company that I mentioned yesterday on reconciling tablets. It's called Chiku and Curcuma.
Right, spell that.
CHIHKUCURCUMA. Curcuma. CURCUMA. And
I'll write it down and have it for you
it
guys.
works for tumors. I wrote about it in my book, but mostly specifically for fatty tumors. We haven't seen fatty tumors go away, but we'll have a fatty tumor growing, and you go on this, and all of a sudden, over the next 3 years, it grows 10%, where it grew 3 times the size in 2 or 3 months. So,
Can humans take the Chiku Roomba?
yeah.
Cool.
Yeah, I think, well, no, they probably can because it's all, the guy that developed this was an herbalist in Chinese medicine for humans and then applied it all to animals. So, and sometimes you just have to remove lipomas, not because they're dangerous or they're malignant, but they're cumbersome and they get in the way of functioning of life. You'll have one in the armpit and they can't use their leg.
Yeah.
You remove it. It's not a huge, drastic surgery.
Would Magna Wave do anything?
It could enhance the nutritional supplements. I would definitely try Magna Wave because if there's any inflammatory reaction secondary to the lipoma, why not? It's
Yeah.
not gonna hurt, that's for darn sure. Hey, you were really
All right,
scared.
we're gonna switch. What group are you guys?
B.